for my family to be on Medicaid. And then when I was in college, I had to reapply on my own. I was given a long list of documents that I would need to support my case for eligibility. I faxed them in using the number that was given to me on my paperwork, but weeks later, I was denied coverage because they claimed they never got my paperwork. It took another several weeks, juggling 2 jobs and a full course load of classes, to eventually make it to the Family and Social Services office while it was open. When I walked into the office, the first thing I saw was a carousel of pamphlets advertising where to donate plasma for a few extra bucks. It felt horrific to see just how many ways wealth can be extracted from our bodies. While I was there, they told me that their fax machine didn't work, which is why I was denied coverage. Right now, as hundreds of thousands of people are up for Medicaid redetermination in Indiana, 82% are being denied for procedural reasons like this one.
That's not right!
It took a few more visits, lots of crying and stress, and tracking down the right documents to finally prove that I qualify. The whole process took 3 months, and I was one of the lucky ones that in those 3 months, I didn't need any life-saving medication or health care. Because the material outcome of these barriers to care is death, is policy murder. I carry the memory of too many people who have died because they were forced to ration existing medication or go without health care altogether. It doesn't have to be this way.
That's right. Yeah.
It'll soon be a year since the federal emergency has ended, quietly stating that the pandemic is over, despite 23,000 people dying of COVID in the past 3 months, all while employers no longer have to provide paid time off if you're sick with COVID. And while this is happening, 15 million people have been cut from Medicaid since April of last year. That's over 380,000 people in Indiana alone.
Shame! Shame! Shame!
This is forcing people to battle through the impossible system of proving eligibility, navigating private insurance, or going without care altogether. I was cut from Medicaid in August. Many of us who are cut are told to look to the Affordable Care Act, but the reality is that these plans cost more and they provide less access to care. So it's no surprise that only 13% of the people who are cut from Medicaid then enroll in an ACA plan. We're told that guaranteeing health care as a human right costs too much. An absurd assertion when billions are sent to fund genocide when it could be used to support life.
Yes!
Each and every one of us has a healthcare story. And in the Nonviolent Medicaid Army, our stories are rites of passage that deepen our connection, our insight, and our collective power. A friend and leader in Elkhart got his Medicaid cutoff letter 1 month ago, but he shared his story, we studied our rights together, and just last week, he went in with 6 others from the Nonviolent Medicaid Army to submit his appeal. The office called him back in 4 hours to say that he had his coverage back. This win shows the power that we have when we organize and unite together. All of you listening to our testimonies today is an essential part of building a movement. As we listen, we are holding each other, and we are declaring that we are not heavy, and that there should never be a price on our lives. And when we walk together, we build a road toward healthcare as a human right, to affordable housing, to a halt on environmental destruction.
Yes!
And ultimately, we lift each other up toward a collective and just society.
Yes!
Forward together!
Not one step back!
All right.